Hello everybody. Here we continue our discussion on heart and talk about the risk factors for developing cardiac disease. Family history is one of them. Anybody young in the family dying or having cardiac disease, someone below age of 55 in men, below 65 in women, then it is considered something which increases your risk. And advancing age, obviously, something which is not correctable. All we can do is take care of all the risk factors and age gracefully. Cholesterol, it's something which is always implicated. A major breakthrough has been the cholesterol lowering medicine in the management of cardiac disease, and all patients with ischemic heart disease are on this cholesterol modifying drug, statin. We look at the three types of cholesterol. The LDL, the bad cholesterol, should be low, and HDL, the H, the good cholesterol, which should be high. And the triglycerides, now considered as an emerging risk factor, maybe more also because of the relationship to obesity and diabetes, but high triglycerides are also considered a risk. Excessive body weight, obesity and inactivity, both of them together. And this is probably because of the host of other diseases which comes of the metabolic nature. Hypertension and diabetes. These are the major risk factors among diseases, modifiable and non-modifiable. And among behavior, the most important is tobacco. The number one leading cause of death due to use of tobacco is actually ischemic heart disease, coronary artery disease. Those who use tobacco regularly, there are more chances of dying due to cardiac disease, even more than the lung disease. And if you look at the overall preventable deaths in the world, tobacco stands at number one in all forms, smoked, chewed or whatever. Alcohol, there is some interest, especially from the wines that came, Italian wines, the antioxidants available in them, maybe because how they are sourced from the grapes and other fruits which have high antioxidants. But alcohol is toxic, especially in high amounts. Somebody used to taking alcohol should take it less frequently in smaller amounts, maybe less than a drink or so a day on an average. Exercise, it modifies your risk for cardiac disease, it modifies many of the risk factors associated. It has a lot of good effects on other metabolic disorders like hypertension and diabetes. So it is always encouraged. And we classify them in two types: aerobics, basically which are cardio exercises which mainly manipulate your heart rate, and resistance exercise, which are the strength exercise. You do it in combination. For a healthy heart, it is recommended to do 30 minutes plus per day, most of the days in a week. Exercise also exerts your heart. It increases its oxygen demands. So if your heart is compromised, it is going to give you early symptoms also. So exercise is valuable in detecting cardiac symptoms early. What are the tests that I can do? An ECG? Well, it gives some information. Baseline ECGs may not give so much information. But one thing it does is, if you have an ECG, you keep it as a reference for future. There, it might be of value to compare any changes. Always store them in a smart device because the ECG papering goes away very fast. Echo, which is an ultrasound of the heart. So we look at the contractility real time. There's no advices, but not a bad idea to get it done and see how well it contracts and relaxes. And stress test, which is basically doing both of these on exercise. And as I said, exercise increases your cardiac demands, may unmask cardiac disease. And we are all familiar with the TMT test that we do. We have the leads attached on our body and we just see how the ECG changes. Well, they are more sensitive than these ECG and echo at baseline, but there is one problem, especially in people who are young, have no risk factors, and they do this test because 20 to 30% of the time they give false positive results. So you can see some changes, but you don't have anything. So interpretation of these tests should be done in the clinical context, and no point at 20 years of age going and running on the treadmill to find out whether you will have cardiac disease. Some risk assessment should be done prior to stress tests. What to do about food? Something which keeps you in balanced weight is a good food. Antioxidants maybe which promote cardiac disease, maybe you can try naturally, or they are available as medicines. The most important thing that you can do is modify your risks, appreciate them on time, check them in time. Hypertension at every contact. Diabetes, we say below the age of 40, if you have family history below that, but with glucometers available all around, get it checked whenever you can, even in early age. Your cholesterol, 20 years of age and onwards, keep a regular check on your body weight, and substance abuse, keep it to minimal. Tobacco, no. Alcohol, maybe minimal. Exercise regularly. This is all you need to do. And if you have symptoms that we discussed in our early video, rush, take medical help. You cannot afford to lose any cardiac function. We need that organ till our very last breath, beating every time.